Hey doctor, I'm bleeding and yet I'm pregnant. I could be having a miscarriage. Have you heard of that before? People come and say, Doctor, I'm bleeding. I could be having a miscarriage. Do you know a miscarriage? A miscarriage is where we confirm that you've been pregnant and now you are bleeding, you're losing it. It's coming out. If your baby is coming out before time, that is a miscarriage. The other term can be an abortion. We call it abortion in the medical way, but simple terms is miscarriage. If you have been pregnant and it is coming out, it is a miscarriage. There are types of miscarriages, we know. Number one is an inevitable miscarriage or inevitable abortion. This is where you don't know what the cause is, but the baby is coming out. You're pregnant, but it's coming out. Most common miscarriages happen in the first trimester. That's the first 3 months of pregnancy. It's always good to check yourself before time so that you can know that you are guarded from those ill fortunes. Another type of miscarriage is the incomplete miscarriage or incomplete abortion. This is where you are bleeding and some products of conception are getting out and a few of them remain. So in this case, the products that would make a baby have come out, but others have not come out. So in that case, it is called incomplete miscarriage or incomplete abortion. The other type of miscarriage is the complete abortion. And here, the baby has come out completely with the products. Here, we call it an embryo. We can call it a fetus or anything. As long as it's a baby forming mass, it comes out completely and there is nothing that remains inside. In this case, it is a complete miscarriage or complete abortion. And there's also another type which is called threatened miscarriage or threatened abortion. Here, there is a tendency of your pregnancy to come out. It wants to come out, but it's not yet out. So it wants to come out. So the signs of bleeding, spotting, like the baby wants to come out. In this case, your pregnancy is almost coming out, but it's not yet out. So we call it a threatened miscarriage. It can advance into complete or incomplete miscarriage if it's not handled in time, or it can even become an inevitable abortion. In any case, if you happen to get a bleeding in pregnancy, that's a bad sign. Report as quickly as possible. My name is Dr. Frank Kamanzi here at KAFRA General Hospital. Bring your issues and then we can talk. When you come to our place, what we do, number one, we say we want to do a scan. If we do a scan, we can find out really which type of miscarriage is this. Is it really complete or incomplete? Then we can find out the solution. Then number two, we also confirm HCG to find out really if you have been pregnant. If the hormones show that you have been really pregnant, then we confirm it's really a miscarriage. The other thing we do, we can give you emergency treatment to help you out if we want to prevent that from happening. In case it's a threatened miscarriage, we can really prevent that. Usually, we can put you on bed rest for a week or plus, and then we can also put you on appropriate treatment in time so that we prevent those miscarriages. Danger sign number one, if you get these signs, just know miscarriage may be coming. You're pregnant and you see low abdominal pain, be careful. Run to the hospital, run to KAFRA, ask. You may be having a miscarriage to come. Lower abdominal pain is very, very bad. It's a bad sign. Spotting. If you see some bleeding and yes, you're pregnant, run to the hospital. It's a dangerous sign. Then if you see suddenly that the signs of pregnancy are going and deteriorating, going away before time, yet you've been vomiting, weak, and then the signs go away so quick, please, there may be a problem. Run quick. There may be a problem. We need to help you. So, and other signs can also be vivid. However, there are other cases where you must run and do a scan and check yourself. In case you've been having a baby in the stomach and then the movements suddenly go away, you do not feel any movements of the baby, run and do a scan. We find out if the baby is still alive, because if it's not, it could be an IUFD. IUFD simply is intrauterine fetal death. That's a bad thing I don't want to dream of you having. So please run to the hospital in case you happen to get that problem. And also, in case you feel like you do not feel normal like before, whenever you feel abnormal, run for a scan. Abdominal scan or obstetric scan is very important in pregnancy. It's usually done like 3 times during antenatal. Please run for antenatal care. We shall advise you more. And then in the next episode, I'm going to take you through antenatal care package, and you will know how you can cater for your pregnancy from day one until you are 9 months old. My name is Dr. Frank Kamanzi. Keep following us on our social media handles on TikTok, on X, which is Twitter, on Facebook, on YouTube, on WhatsApp channel, on Instagram, on Google. We are using the name KAFRA General Hospital everywhere. You can follow the Google Maps and find us at the location here in the city of Kibuye on Salaama Road. We shall be glad to see you. Once again, our number and my personal line is 0757 10 10 40 and 0789 960480, and our website is www.kafrageneralhospital.org, and our email is info@kafrageneralhospital.org. I'll be glad to get a feedback from you. In the next episode, I'm going to talk more about antenatal care services and why you need it. Follow for more. Thank you.